Well, hello, everyone, and welcome to our webinar. We are so excited to introduce our latest collaboration with AMA to bring you clinical education to improve hypertension control in Georgia. Now, before we dive into the presentation, I would like to introduce our presenters. My name is Jasmine Kaur. I'm the Marketing and Communications Director here at MAG. We also have Josh Zabo, our Operations Coordinator here at MAG. And we would also like to welcome and thank both Rupi Hayer, Senior Manager of Chronic Disease Education at AMA, and Beth Tapper, Senior Manager of Community Strategies and Impact at AMA. Thank you all for being here. Now, a quick overview of today's agenda. We just closed out with introductions. We're going to move into an overview of the MAG and AMA collaboration, followed by an understanding of the importance of blood pressure measurement training. Next, we'll have a review of AMA's Measuring Accurately series, and then we will close with Learn How to Access AMA's content and earn CME credit. Now, I'll toss it over to Beth.
Thanks, Jasmine. On behalf of the AMA, we are thrilled to announce this collaboration with MAG to bring our cardiovascular disease prevention series to the physician members of MAG. AMA and MAG have had a long-standing relationship, and this initiative builds on our shared commitment to work together on policy and quality improvement efforts to help physicians across Georgia improve hypertension control for their patients. This project also supports the Atlanta Hypertension Initiative, where MAG plays a key role in working towards improving cardiovascular disease outcomes across the Atlanta region. We strongly believe that this series will provide MAG members with evidence-based tools and resources to improve accuracy and blood pressure measurement, and hopefully serve as a foundation for subsequent series to come. Now I will turn it over to my esteemed colleague, Rupi Hayer, to walk us through the components of the series, as well as background on AMA's Hypertension Quality Improvement Program. Rupi?
Thank you, Beth. As Jasmine mentioned earlier, I manage the chronic disease education portfolio here at the AMA, and I'll spend the next few minutes going over one of our newer resources called the Measure Accurately series. But before we do that, let's begin with reminding ourselves why accurate blood pressure measurement is important. So I think it's safe to say we all know that cardiovascular disease is the leading cause of death in the US. Go to the next slide. The latest data shows that nearly 1 million individuals lose their life to cardiovascular disease every year. When you look at what we could do to make a difference, blood pressure control stands out as a key opportunity here, especially since we have seen a decline in control rates for the last 5 to 10 years. Here at the AMA, our North Star is to improve blood pressure control rates within the US. If we go to the next slide. The framework we use to help improve blood pressure control rates is the MAP framework. Here, the M stands for Measure Accurately, which is to obtain actionable blood pressure measurements to diagnose hypertension and assess blood pressure control. A is Act Rapidly, which is to initiate and intensify treatment when indicated. And then P is for Partner with Patients to support patient activation and to assess and improve adherence to treatment. Go to the next slide. And unfortunately, when it comes to M, we know there is an established performance gap across the board. We know that students are not performing well on this particular skill. In fact, in a study that was conducted on 159 medical students several years ago, only one student had a perfect score, and on average, students failed to perform more than half of the BP measurement skills correctly. Pretty sure that's not the kind of bell curve we want to see when it comes to clinical skills. So if students aren't performing well, it's no surprise to see that there's also a significant performance gap among practicing professionals. We know that this is partially due to the initial training within medical schools. We know that training tends to be brief and limited, but we also know that skills and knowledge in this area tend to decay over time, and refresher and retraining on this topic is needed. In fact, guidelines actually recommend that ongoing training every 6 to 12 months is required to really continue to master this skill. So knowing that there is an established performance gap and that guidelines recommend ongoing training for all care team members, AMA has developed the Measure Accurately series as your go-to resource for retraining. So let's go to the next slide. So now I'll give you a little bit of an overview of the series itself. So if we go to the next slide, we know that practicing professionals have received some training on this topic. So this is really designed to be that go-to resource for refresher training. We also know that your time is very limited. So this is why this series is built as a quick refresher, offering bite-sized content to help reinforce best practices both efficiently and effectively. If we take a look at the target audience, who are we targeting with this particular series? We're saying all practicing professionals with a primary focus on physicians, nurses, NPs, pharmacists, PAs, and MAs. Now, you might be thinking, but I usually have my MA or nurse take the measurement. And yes, we absolutely recognize and support the vital role they play. However, accurate blood pressure measurement is really a team responsibility. That's why we believe retraining is essential, not just for those who do it daily, but for the entire care team, including physicians and physician assistants. When everyone understands the why, along with the how, we strengthen quality, consistency, and ultimately patient care. The series itself consists of 3 short interactive modules. The first one is called In-Office BP Best Practices. Second one is Self-Measured Blood Pressure Best Practices, also known as SMBP. And then the Self-Guided BP Training. And the good thing with this series is that you can earn up to 1.5 CME credit by completing the entire series. Now let's go to the next slide, and I can give you a little bit of a breakdown of each of the modules and what they consist of. So the first one is the in-office BP best practices. So this offers a quick but comprehensive refresher on how to take accurate readings in clinical settings. Perfect for those moments when you want to just double check your technique. The SMBP best practices, this one is focused on SMBP and really helping you as a clinician better partner with patients to make sure their at-home readings are accurate, are consistent, and clinically useful. We recognize the shift to telehealth has warranted an increase in SMBP readings, which is why we had this as a standalone module itself. And then we have our last one, which we call the self-guided BP training. This one is a little bit more flexible. Think of it as kind of you're choosing your own adventure. So learners can either jump straight into specific topics they want to brush up on, or they can take a quick assessment, and that assessment will help you identify where you should focus your time on and what your gaps are. If we go to the next slide, here are just a few screenshots from the series itself. On the top left-hand side, you can see this is taken from the self-guided BP training. This is where, the first question we ask you is what would you like to do here? Are you looking for something particular, a specific area of BP measurement that you want to refresh your skills and knowledge on? For example, patient positioning, patient preparation, or do you want to just take an assessment and figure out, where your gaps are and get content tailored to your specific needs? The other 2 screenshots are just some ideas of how kind of we've set up the content. We've tried to make it very visually engaging. We've simulated real life situations. We also recognize that when it comes to preparing a patient, there are several key steps associated with that, and we talk through kind of the potential errors that could exist and what that could entail. Now, if we go to the next slide, well, I'll pass it over to my colleague Josh at MAG, who will talk us through how to access this content through the LMS system.
All right, thank you so much, Rupi. Give me 1 second, let me pull this up. All right. So now let me show you all how to walk through online and access this content. First, you'll go to mag.org on your internet browser. Okay, under the tab here, Membership, Member Benefits, go to CME Opportunities. And here on the right, see this flyer? This is a link to our MAG's online CME library, also called EdApp LMS. This is the exclusive home of all of MAG's CME, including state-mandated courses such as Health Bill 458 and DEA MATE. So if you do not have an account, you'll enter an email, create a password, enter it in there. I'll be logging in through an account that I already have set up. Bear with me 1 second. Okay, once we are inside the EdApp LMS, you see this link right here, link to AMA EdHub CVD Prevention. Go ahead, click on that. And you will see here, Start Lesson. And all this is a portal to a custom link that we've created to access AMA's Measure Accurately series. So you'll click this link. This will now take you to the AMA EdHub CME website. You see AMA Measure BP Accurately series, and here are your 3 courses to access. So in order to get credit, you have to click here, sign in to earn credits. Now, I assume most of you will have an AMA account. If not, you can just down here, create an account and create a new one. I'll be logging in with my account that I already have. So here on the AMA EdHub, now that we're logged in, we see these 3 courses here, self-guided BP training, in-office BP best practices, and self-measured BP best practices. Let's just click on one of these to see what it looks like inside. Now that we're inside the course, you see title, you see learning objectives. Scroll down to see the module. So we'll click on this button here, and this will open a video that we can now take the course.
Sure, accurately.
Once we complete the module, go over here to take quiz. You'll take the evaluation quiz based on the performance of the course. And afterwards, you will be given directions on how to receive credit for completing this module. And all three modules function the same. Okay, now I'd like to go ahead and move forward with a Q&A session. Okay, so now that we're moving into the Q&A, here are just some frequently asked questions we might run into. Are all 3 components of the series required in order to get credit?
So each of the modules have their own CME credits. So the 2 shorter modules, so the in-office best practices and the SFBP best practices, those are 0.25 credit each. And then the self-guided BP training is 1 credit. So combined is 1.5 credit, but you can do each individual activity and earn that credit that's assigned to it.
All right, thank you. What if I have issues logging into the MAG LMS or the AMA EdHub?
Yeah, we recognize that sometimes from time to time that can happen. So we have our contact information that we'll share at the end of this deck. So if you have any issues with the AMA EdHub, please feel free to contact myself. Otherwise, if it's something to do with MAG, please go ahead and contact Josh.
That's right. And then how can I find other resources on the AMA MAP HTN program?
Yep. So as we mentioned, the MAP framework is the foundation for our MAP hypertension program. And so the website that we encourage you guys to visit to learn more about the program, or if you want to connect with any of our AMA colleagues, it is www.map-assn.org. Awesome. And then just to wrap things up, so here's our contact information for both Josh and I. If you have any questions or want to connect with us to learn a little bit more, feel free to reach out via email.
Always welcome.
Thank you for joining today.